Mercury in dentistry, risks to human health and the environment. Say no to mercury in dental treatment. Move towards mercury-free dentistry. Mercury is a metallic element that occurs naturally in the environment. It is also a potential contaminant of the environment as well as a global concern due to its health and environmental impacts. It is toxic in nature, bioaccumulates, and has transboundary impacts to health and the environment.
Amalgam contributes mightily, tragically, and illegally to the use of mercury in gold mining. The amalgam makers know they are selling their product to unethical dentists, unethical pharmacists, and gold traders who resell it pretending the amalgam is for dentistry and it's not, and resell it into the gold fields to the destruction of entire communities.
What is a dental filling? A filling is a way to restore a tooth damaged by decay back to its normal function and shape. When a dentist gives a filling, he or she first removes decayed tooth material, cleans the affected area, and then fills the cleaned out cavity with a filling material. Major health impacts of mercury dental amalgam: reduction of body's disease defensive capacity, damage to the brain, kidneys, and immune system of children, memory disturbances, lack of adhesion which may lead to a marginal leakage, respiratory problems, oral cavity problems, effects on reproduction, neurological problems, reduction of vision and hearing capacity, hair loss, skin cancer and kidney damage, damage to healthy cell tissue, gastrointestinal problems.
Mercury includes the respiratory disease, central nervous system disease, depression, and even autism. So mercury-free struggle of mercury-free dentistry is started in Bangladesh.
Harmful effects of dental amalgam, mercury on the environment. Released byproducts of amalgam have a broad effect on waterways because a portion mercury will be converted into highly toxic methyl mercury by anaerobic organisms present in rivers, lakes, and waterways. Mercury pollution is particularly damaging for long-living fish species as they have a high exposure to methyl mercury over time. Dental amalgam waste has been identified as the major source of mercury soil pollution because it reduces microbial and the soil, reducing soil fertility and productivity.
Hello, I'm Dr. Joseph Elizabeth. I have completed my graduation from Bangladesh Dental College in 2012. I just want to say that the fillings which are using in case of dental treatment, mercury amalgam filling is one of them, in which we are using liquid mercury, which is very harmful for both the patients and the dentists. So I want to request all the patients, if you are going to seek for any dental treatment and you need filling, then be sure that which kind of filling your dentist is going to use in your tooth. Is it mercury or amalgam filling? Then directly say no to the metallic fillings because it is harmful for you. It will cause Alzheimer, miscarriages, abortions, and a lot of problems.
Mercury is used to bind the alloy particles together into a strong, durable, and solid filling. When placing dental amalgam, the dentist first drills the tooth to remove the decay and then shapes the tooth cavity for placement of the amalgam filling.
We use this mercury for this permanent filling or this amalgam filling. So this amalgam is made of mercury and alloy. So this mercury, it is during use, during mixing, and after mixing, it is poured into the mouth of the patient. So this acts as a source of mercury in the human body.
About 80% of inhaled mercury vapor is retained in the body and dissolved mercury vapor concentrates in circulating red blood cells. Environment and Social Development Organization ESDO is the pioneer organization working in mercury phase-out in the country.
The World Alliance for Mercury-Free Dentistry salutes the Environment and Social Development Organization, ESDO, with its 25-year record of working for the people of Bangladesh. It is the brainchild of journalist and environmentalist Dr. Shahryar Hossain, my very close friend and one of the world's foremost NGO leaders. ESDO is changing the dental schools. 4 dental schools already are mercury-free and changing the others. It's working with the Dental Association.
ESDO, with World Alliance for Mercury-Free Dentistry, has taken the responsibility to make Bangladesh aware of mercury-free dentistry and with the partner organization.
Environment and Social Development Organization initiated the nationwide campaign on mercury-free dentistry in the year 2010. We are working closely with the World Alliance for Mercury-Free Dentistry based in Washington, D.C. At the same time, ESDO is leading the Asian campaign from Dhaka. It is an important issue for our environment, for our future generation. So, ESDO initiated this campaign to create public awareness, to educate, to aware the policymakers about the harmful effect of dental amalgam.
What are the alternatives to dental amalgam? Currently, a number of different material types are being used as substitutes to dental amalgam, and these include composite resins, glass ionomer cement, compomer, geomers, plastic ionomer, gold foil. Besides the dentistry issue, ESDO worked with mercury product identification, assessment of mercury in fish and human hair sampling. As part of international campaigns to stop using mercury dental amalgam globally, ESDO, in association with World Alliance for Mercury-Free Dentistry, has initiated countrywide campaigns in Bangladesh.
Dental amalgam is a primitive 19th century product which is 50% mercury. Its use is challenged in the Minamata Convention on Mercury.
We are proposed the ban of dental amalgam uses in Bangladesh, and we have a joint statement to the Prime Minister of Bangladesh to stop the import of dental amalgam and encourage the alternative materials for dental fillings.
What should we do? Dentists should avoid the use of mercury dental amalgam and use alternatives. Public awareness must be increased to phase out the use of dental amalgam and the hazards associated with it. Dentists, dental hygienists, and oral health therapists should discourage the use of mercury dental amalgam and encourage safe alternatives. Government, non-government, and civil society organizations should step forward to raise awareness of the impacts of mercury-based dental amalgam on human health and the environment. Never let your dentist use mercury in your mouth during dental treatment. Campaign for Mercury-Free Dentistry. WAMFD, ESDO, Asian Center.